Can you recover from annular tear without surgery? The answer is yes. If you get the right guideline and rehab plan, you can definitely recover from annular tear without surgery within 3 to 4 months. In this video, I'm going to share with you my online clients, Jessica, who lives in Dubai. Jessica contacted me 4 months ago due to multiple level annular tear in her lumbar spine, and she was told that she needs surgery, but she contacted me because she was not able to work, she was not able to sit more than 1 minute, and she was quite devastated in regards to her injury, and she was not sure what she has to do and what would be the best plan for her recovery. We started her rehab plan 4 months ago, and in this video she shared with you couple of important tips and her story in regards to her recovery. And if you're suffering from annular tear, I believe this can be hugely helpful for your recovery. If you've never been in this channel, my name is Bob. I'm a physical therapist. I help people globally through online consultation and rehab plan, and I provide them clarity about what they have to do in regards to their injury. And if you're suffering from chronic lower back pain, sciatica, disc bulges, annular tear, and you've been told to do surgery, I highly suggest you to avoid jumping to surgery right away and get a second opinion. I will be happy to give you some tips and second opinion through online consultation. You can book your consultation with the link below and we can get you started right away. We've been working together for quite some times now. You've been working out with me and working with me for a while. Today, what we're gonna do, we're just gonna share your story. How did you end up contacting me, and how did you find working with me online, and where you at right now with your recovery?
Okay, yes, Bob. Yeah, I actually had my injury last year, September of 2023, when I was here in Dubai working in the office. I woke up with debilitating pain and it was number 10. I went to some of the doctors, orthopedic doctors, and they told me the procedures like hot pack and wearing the brace
Yeah,
and
like a
go for,
belt, basically.
yeah, like a belt basically, and also go to a physiotherapy. And I went that on physiotherapy, and it gave me like
Yeah, adjustment.
chiropractor adjustment
Yes.
manipulation, and
Mm-hmm.
I was fine, and I was very happy that I'm okay. Then I go
Yes.
back to work again.
Yes.
And then after 2 weeks, it get my back on my back pain again and this side.
Gotcha.
And I don't know what to do. I don't know how to get rid of the pain. So I go again for another doctor, orthopedic doctor, and he
Yeah,
asked me for an MRI.
got you. He asked you
And
basically go get an MRI scan.
yes, MRI scan spine.
Mm-hmm.
And actually, I get that.
Got you.
And he told me that I don't have too much issues because he checked also my plexus. It was
Mm-hmm.
okay.
Got you.
And he did not give me a clarity of my diagnosis, even
Got
I
you.
have the MRI.
Got you.
And he just told me that you can get held over time.
Mm-hmm.
He did not tell me that I have disc bulges or annular tear. He did not
Yes.
explain to me anything
Got you.
about that kind of diagnosis.
Got you.
He told me I have a muscle spasm radiculopathy. So he
Mm-hmm.
just given me some pain medication, muscle relaxants, and he
Got you.
told me just take this one in a week by time.
Mm-hmm. I
Then,
got you. And that person you met,
uh,
it was the orthopedic or consultant.
yeah, it is an orthopedic doctor.
Got you.
Yeah,
Mm-hmm.
yeah, and I actually asked him also if I can do
Uh-huh.
massage.
Yeah.
Yeah, and he told me, okay, no problem. Then
Got
I
you.
just go for a massage here, and that thing actually, Bob, get my pain worse. because
Which means
of that massage.
you got massages and the pain got even
Yes.
worse after the massage.
Yeah.
I get you.
Right.
I got you.
Correct.
Okay.
Yeah. And then I get anxiety. I keep searching on Google what is my diagnosis because I don't know how to fix my pain.
I
And
get you.
and then I get decided to go back to my country,
Mm-hmm.
Philippines, because I'm
Okay.
working here in Dubai.
I got you.
Then I traveled last December
Got
going
you.
back to Philippines.
Just go. Before you continue, like when you gone back home, what happened there? What was your symptoms look like in that stage of time? Like it was only
Oh,
pain. What was it look like?
yeah. Oh my God, Bob. It was very painful. It is number 10. Back here is very painful. My buttocks also is very painful, and also my nerve pain here down in my legs. It's
Okay,
just
in
like
one
I
side.
cannot sit.
Okay, was it on
Both
one side or
sides.
both side? Okay,
Bilateral.
got you.
It's
Got you.
bilateral. And I
Mm-hmm.
cannot also, I only laying down on the side. I cannot go on the other side because the pain here is very painful.
Got you. And
Yeah,
were you able
and
to
I
work
have,
in that stage? Were you able to work?
yes, I was able to work that time, but I
Mm-hmm.
cannot sit.
Uh-huh.
Like 10 minutes. Even 10 minutes, oh my God, my butt is very painful and my back is very painful.
Got you.
I even get the pain, the injection.
Uh-huh.
Like, I don't know what it's called, just to
Yeah,
relieve the pain for one day
I
because I
see.
cannot,
Basically like a painkiller, like a basically
yeah,
morphine
painkiller, the
or
liquids
yeah,
also.
yeah. Like
I
maybe
don't
morphine
know
or
that.
something. Yeah, yeah. Okay.
Yeah, something
Okay.
like that.
Mm-hmm.
And I even crawling here in the office as well. Even my colleagues looking at me, I go to the sofa and lie down.
Got
It's
you.
very painful, and
Mm-hmm.
I sometimes in the day, in the night, I cannot sleep, and I was crying, because I cannot get rid of my
Yes,
pain, and no one support me as well
of
because
course.
my family is back home Philippines.
Of course.
So
Then
so
you decided to
I
go
have
back home.
Yes, I have decided to go back home last December
Mm-hmm.
of 2023.
Yes.
And I went to orthopedic doctor because some of the doctor here because I've been for like 5 doctors here in Dubai, and
Got you.
some of the doctors told me that you are severe. He told me
Yeah.
you are severe. Your back pain is keep on coming back. The
Got you.
best way only that you can get rid of this pain is to get the surgery.
I get
So
you.
again, when I heard that word, I was very panic
Of
because I
course.
don't want it. This is the worst pain that I have it in my entire life
I
so
got
far.
you.
Yeah,
I
and
got you.
then that's why I have decided to go back home.
Home. Yeah.
Then when I go, it was very painful when I was also on the plane, go back home
I
to my
got you.
country. Then I go suddenly to one of orthopedic doctor in my
Mm-hmm.
country in the
Yeah.
Philippines,
Yeah.
and he actually is good. He told me like, you cannot still not at the moment that you need to go for surgery. That's what he
Got you.
said.
Mm-hmm.
You need to have at least 6 months physiotherapy.
Mm. Very good.
And then he's given me it's called like anticonvulsant medication
Mm-hmm.
that
Mm-hmm.
helps my anxiety
Yes.
and helps me sleep.
To
So
calm down
that's
and sleep.
get calm down and sleep. So
Yes.
that medicine actually helps me to recover
I
that
got you.
days because doctors here in Dubai didn't give me that kind of medicine.
I got you.
Yeah, and I actually went there for physiotherapy in my country.
Yes.
Like maybe I could say, Bob, like 6 sessions. I went
Mm-hmm.
there
Yeah.
and I did the decompression table.
Yeah.
Uh,
Decompression table.
but
Yeah.
yeah, but since then I'm not comfortable on it because I feel like I have pain. So
Got you.
I stopped the decompression table,
Got you. It didn't help as
and
much.
it did not help as much. And
Got you.
then I went for like 6 sessions for physiotherapy. I went
Mm-hmm.
to the clinic, and ever and since I am here in Dubai, I actually saw you already
Yes.
on your YouTube
You saw
channel.
me in Dubai. Yeah. Got you.
Yeah, I saw you in Dubai, and it's just like I did not focus on that because first thing in my mind is I need to go back
Go
home.
back home. Yes, of course.
Yeah, go back home because someone
Yes.
will look after me. My family is
Yeah.
here, is there.
Yes. Of course.
Then and then I did that physiotherapy, and then I did that
Yeah.
transition of your physiotherapy because rather that I'm going to the clinic in my country,
Yes.
why instead I'm going do my physiotherapy online and
Yes.
it's at home.
Yes, of
Then
course.
I no need to travel.
Travel to the
Yeah,
physio. Yes.
yeah,
And you decided to
and
contact with me basically by that time.
yes, because I
Mm-hmm.
got motivated. I saw all your videos. I saw most of your testimonial of clients,
Yes.
and I got motivated. And I was thinking I can get hope that I can get better
Of course.
and go
Of
back to
course.
work. Yeah.
100%.
Now
Excellent.
I'm so happy with my progress.
Excellent. Then maybe
Yeah,
just go start with how did we start your plan? Like I suppose because when we start
consultation.
your plan at home, how did you find the initial consultation? Like when we discuss your symptoms, your MRI scan, etc.
Yeah, it's actually very helpful, Bob, because you you give me clarification of my diagnosis, not to get me panic. Like you actually explain it to me one each like you
Letters
explain it
or
to me properly.
terms.
Yeah,
Yeah.
the terms, the
Yeah.
terminology,
Yeah, of
you
course.
explain it to me properly,
I'll
and
get you.
also and then also the diet plan that you have
Yes.
given to me that
Yes.
keeps me more stronger,
Of
and
course.
also you advised me for some supplementation like having some magnesium,
Of course. Yeah.
and
Which
also
means the
you have
diet part.
told me that sleep is very important for the
Yeah, for sure. I
recovery.
mean, these are the things that you basically get out of your plan, your rehab plan,
Yes.
etc. But then, when we start your rehab plan, Jessica, how was your symptoms initially, and how's it right now? If you just kind of like describe for people who watching this video in comparison.
I'm pain free now, Bob.
Excellent.
Yeah, from
And
10
how
to
was it?
0.
Yeah, yeah, from 10 to 0. But how was the exercises initially when you start doing them? Were it easy for you to follow them?
It's actually the exercise in the beginning is a bit challenging,
Yeah.
especially for me, because I am a sedentary lifestyle. And
Yes.
also, this is my first time to go to the gym. So it's
Yeah.
really a bit challenging, but
Of
I
course.
keep looking of the videos that you have sent it to me,
Yes.
and I do it consistently.
Of course.
Yeah, and also when I have those exercises, I have to send it to you my video back, and then you modified any exercises
Yeah,
that
which
suits
means you
my
get
body.
feedback. Yeah, you get feedback of
Feedback.
each
Yeah,
exercises. Yeah, for sure.
yes.
And when you say it was very difficult, was it the matter of, that you never trained before, was for you was difficult, or it was because of the pain that it was difficult, Jessica?
It's actually both
Got you.
because actually I have my body, especially my back, is stiffness,
Yes.
very stiffness. Like um I cannot bend before. I cannot
Yes.
bend. I cannot twist.
Yes.
I
It was
cannot.
very,
I
very
cannot.
sensitive.
Yes,
It was
very,
very
very
sensitive.
sensitive.
Yeah,
So
exactly.
it is really, really challenging. But the mobility routine, the daily routine,
Mm-hmm.
that's really helpful
Yes.
for the movement of my body
Yeah.
and doing it consistently. And our body is flexible to
Mm-hmm.
do every movement
Every
that we have.
movement. Yeah.
Yes.
But I
So
suppose it
that's
took you a
really hard.
while to get used to it, Jessica, as well, right?
Yes.
It took you a
Yes.
while, yeah. And
Yeah,
and
because
and and I
I'm a
suppose for
sedentary
somebody,
lifestyle.
yeah, but you didn't have any access to the gym as well initially. I know you're in the gym right
Right,
now,
correct.
but
Yes.
initially you didn't need any gym equipments or like weights or anything. You basically can follow all the routine in the house without any equipment or etc. And that I think was very helpful in regards to the convenience of it, right?
Correct, right, correct. And
Absolutely.
also the walking.
Yeah.
Yeah, the steps, the walking, like I do it like minimal. Like in the beginning, you have told me you need to walk at least 3,000 steps
Yes.
in a day.
Yes.
And then I keep doing it consistently,
Got
and
you.
then progress, and now I can do like 10,000 steps, more
Absolutely.
than,
Absolutely.
yeah, coming
Yeah,
back to work and go to
for
the
sure.
gym for cardio.
Amazing.
Yeah.
Yeah, for sure. It's been a long
Yes.
way of progress, Jessica, I suppose. It's been a
Yes,
long
it's
way.
not
But
easy. It's not
yeah,
easy, and there's no shortcut on it.
that's
Yeah.
very important. Jessica, we have to restart this link because it's only 40 minutes. We can
All right.
continue the recording in a second. Okay, just restart the link. Just give me 2 minutes,
All
yeah?
right.
Thank you. We can we can continue. Okay, then
Yeah.
if I go through like then you progress from home exercises. We now got you to the point that you're going to the gym, you're training in the
Yes.
gym.
Yes. And
How
lifting
did
weights.
you? Yeah, and lifting weights because this is new for you, right? And all new.
New.
You never done them before. But my question
I
is that
never
Jessica,
have done before.
yeah. My question is that how did you find the overall program? Because in the program, we don't only kind of like prescribe you like exercises. You measure your
Yes.
sleep, you measure your steps, you measure your activity, you measure your, I
Yes.
suppose, stress level, you measure your
Yes.
sitting
Yes. Yes.
hours. Like pretty is very, very comprehensive and holistic, and you have a diet plan that you
Yes.
follow. Mm,
Yes.
Did you find those elements
And
helpful?
supplementation.
Yeah,
And
exactly. Like, what
supplementation.
supplements you have to take, etc. Um, how did you find that in regards to basically giving you extra assistance? Did you find those things helpful, Jessica, in regards to your
Yes.
recovery?
Yes. Of course, Bob. Actually, your program is very helpful in my recovery. I get back to work. I'm very happy. I'm
Yeah,
normal. I'm normal now. Like I'm pain free. And
absolutely.
actually, your rehab plan is very in detail. Like
Of course.
you give me like in the sheet. It's like my assignment. Like I
Yeah.
need to do this
Yes, daily.
consistently,
Yes,
and then you are there always, all the time. When I ask you questions,
of
you
course.
give me a feedback, and anytime I can reach you, Bob. Like I have doubts, any questions, you give
Of
us a
course.
feedback and reply, even if you're in Dublin and I'm here in Dubai.
I know,
you
I
you
know.
are very, very helpful and very kind, Bob.
No, I'm delighted to hear that, Jessica, because I think, when we were chatting initially, you had a couple of really doubts about whether you're going to recover ever,
Yes.
because you were very concerned that whether can I recover again, Bob, and can I sit
Yes.
down for long hours because your job is
Yes.
office
Yes.
job. I
Yes.
don't know if you remember exactly. You asked me,
Yes.
Bob, do you
Can I
think
go
can I
back to
recover?
work?
Yeah, can I go back to work? And now I think after like kind of like we working around like 4.5 5 months together, and now
Yes.
you're not
For
only
months and a half.
back to not only you back to work, you already uh, fully recovered. Your symptoms
Yes.
right now almost no
Yes.
symptoms anymore.
Yes.
You can walk 10,000, you can sit for 4 or 5 hours
Yes.
daily with
I
no
bend,
issue. Yeah,
bed
in a
rest.
band, exactly. Yeah, and
Yes.
I think beside that, you start to go to the gym, which is kind of quite
Yes.
a bit of progress. We're still
Yes.
progressing your plan gradually, and you're following a diet that help you
Yes.
to get back, tone up, lose a couple of kg. Because I think
Yes.
you had a
Yes.
goal as well to lose weight and get
Yes.
fit again. And I think this
Fit.
is a very big message that I like to share with all of people watching this video is that like
Yes.
everybody who has back pain they have a common things that they want to just get rid of back pain and they focus
A
purely about
surgery.
pain. Well, like, thinking of surgery
Yeah.
is something that I'm not saying is a bad thing to
Yes.
do if you need surgery. You know what I mean? Because there's a very minor cases. There's less than
Yes.
1% of back pain patient need surgery or urgent
Yes.
care. But
Yes.
I mean, you don't want to make a decision, immediately and do
Yes.
the surgery without trying. And I think your
Yes.
doctor in the
Correct.
Philippines really give you good advice because this is something
Yes.
that I tell all of my patients. Try at least 6 months of recovery. You beat physio
Yes.
and rehab plan.
Yes. Rehab
And
plan.
if you didn't get results, then you can say think of more invasive procedure
Yes.
like injection, a nerve block, or surgery, etc. Now, I think one of the messages that at the same time I wanted to share with them is that focusing on pain can hugely impact your recovery, but
Yes.
by
Right.
focusing in your health, which means what can improve your health
Yes.
while you're having back pain, which
Yes.
means reducing your stress, improving your diet,
Yes.
improving your
And
daily
sleep.
activity and sleep, and getting a
Yes.
little bit of a family and social support because you've gone back
Yes.
home, you had your family
Yes.
around. That's so important. And
Exactly.
basically, getting those things together
Yes.
hugely help your recovery chances and you have
Yes.
more chances of quicker recovery. Now,
Yes.
I would
Correct.
say exercise are quite essential. What
Yes.
are the exercises that you can do? Where can you start and how you can progress them,
Yes. Yes.
gradually is a huge factor that comes from coaching that you get from me, in a day-to-day
Yes.
basis.
Yes.
And I think
Correct.
by having that picture that I'm not trying to just fix my back, I'm trying to improve my health, at the same time
Yes.
improve my symptoms and get myself back to that
Yes.
full capacity that I used to be. And
Yes.
we almost achieved that in this stage of your rehab, which I'm so delighted because you're
Yes.
back to your job, you're independent
Yes.
again, you don't feel like you can't do things, you're
Yes.
able to
Right.
do things, and you
Yes.
gain not only your life back, but you regain your confidence
Yes.
and you're in the gym lifting weights, you bending,
Yes.
you squatting,
Lifting.
you lifting
Yes.
like weights that
Yes.
they probably told you don't do them, and you didn't have that belief that
Yes.
I'm gonna
Yes.
do it,
Doctor told me don't bend, don't twist. Yeah.
I know, and that's something that is common, but if you don't regain back that through
Yes.
some sort of coaching and guidance and
Yes.
regain that trust, you're always gonna be independent to basically some sort of dependent to somebody else to help you either adjust your back or give you massage or give you
Manipulation.
painkillers, exactly, painkillers, etc.
Yeah.
But that's for me is such a great story, Jessica, because
Yes.
like for me to see you smiling again and you're happy and
Yeah.
your symptoms are
Yeah.
controlled, and most
Yeah.
importantly, you can sit. Sitting was a huge
Yes.
thing because I think with
Correct.
sciatica
I'm
pain,
working.
sitting can be hugely
Sitting.
impacted. You know what I mean? And beside that, I think right now you have much more kind of like confidence about your back. You have
Yes.
you going to the gym now. How many times are you going to the gym now, Jessica?
5 days in a week.
That's quite
Yes.
active. I mean, the fact is that not that actually 5 days is better than 3 days, but sometimes people watching this video and they say, okay, maybe I can't go for 5 days. But you initially start your plan from home. You had like
Yes.
20,
I
30 minutes
started
of
from home
yeah,
and
yeah,
do it consistently
absolutely, yeah.
and in progress.
I know. I'm delighted about that. Jessica,
Yes.
I'm asking this question from all of my patients. When you decided to join this plan, I think
Yes.
it's a quite a bit of, I suppose, question whether should I invest my money and my time to follow this plan. Did you have that in thought in your mind that I have to invest my money to actually join Bob?
No, actually, Bob, because at the beginning,
Yeah,
uh, our health also is one of our
of course. Yes,
investment,
of course.
right?
Yeah. But did you had a doubt that, okay, am I gonna get results?
I saw a lot of testimonial on your
Mm-hmm.
clients,
Yeah.
positive testimonials,
Yeah.
and sometimes I may have a doubt, but
Yes.
80% I trust you,
Very
and
good.
I don't think like doubt because obviously as well you are far and we are
Yes.
only doing it online,
Yes.
so that
Yes.
that is also one of a doubt. then
Yes,
how you can manage to guide me, like
absolutely.
uh, at your presence while you are not there
Here, yes,
here.
with you.
Yeah,
Yeah, absolutely.
something like that. So that is a doubt.
Of
But
course.
for me, for the money or something like that,
Yes.
it's actually, I'm thinking, Bob, it is like investment, because
Glad to hear that.
anyhow we need our body to be healthy, to
Of
get
course.
back to work. To get
Absolutely.
back to work, anyhow you need treatment.
Of course. Yeah.
And I did a treatment. I have a rehab plan for you, which is very, very helpful to me. Now I'm back to
Amazing.
work.
Yes.
So that's that's a very,
For
very,
you, for
like,
you,
I'm
for you
happy
wasn't
for
like,
that.
yeah, I'm delighted to hear that. Now, Jessica, if I ask you to share for me maybe four important tips for people who watching this video in regards to your recovery, let's say three to four or even more.
Yeah.
What do you have as top tips that you want to share with people who watching this video that can be beneficial with them? These people can suffer with sciatica pain,
Yes.
disc bulges, similar to
Yes.
you. What would that
Yes.
be? In a
Similar.
very short, maybe if you keep them as a sentence, what would that be,
Yeah.
Jessica?
Yeah. Yeah, basically, if you have this kind of pain, and then you have an MRI, and you didn't get a clarification or clarity of your diagnosis, make sure that you can find a professional person who can guide you, who can explain it to you properly, so you don't get panic, and
Absolutely.
and get some anxiety like me before.
Of course.
And second thing also is, the sleep. It really needs like 8, 9, or 10 hours sleep. That is
Very
really
good.
very helpful for the recovery.
Amazing.
And also that rehab plan that you have for me, Bob, like you guide me, you coach me of my daily routine and the upper and body routine. That is very, very helpful for my body, for my movement.
Of course.
Yeah, and also take some supplementation, like
Improve your diet.
magnesium.
Yeah,
Yeah, and together with the diet,
absolutely.
healthy diet.
Absolutely.
So yeah, and don't go rush to surgery, because that you can go to rehab, you can go to other non-invasive treatment, and don't
Yes.
go rush for surgery, and don't get
Amazing.
panic.
Amazing. Amazing. That's
Yeah.
that's that's lovely. I love them because I think they're all relevant and I always repeat those things to people because I think our body has this ability to heal. And if you give
Yes.
that environment that your body need and get some guideline and coaching from somebody
Yes.
who can give you clarity of why do we do this, why we
Yes.
do this, and how we can do it. If I can't do this exercise, what else I can do instead? Because we
Yes.
customize the plan quite a lot through the
Yep.
plan when you're following. If you can't do a certain exercise, we change them, we modify them, and there's always something that you can do. Jessica, I
Yes.
couldn't be happier with your progress. I'm gonna
Yes.
share your video of exercise that you sent it to me from the start to where you are right
Yes.
now in the gym. And it's quite inspiring for me to see you here trusting the
Yeah.
plan, following and sticking to the plan, and getting back that physical and mental confidence. Thank you so much again.
Yes.
Is there
Yes.
anything else that you'd like to share, Jessica?
Yes, Bob. Like, to those people who are suffering with disc bulges, or any disc problem, back pain,
Yes.
and they don't have any clarity about their diagnosis, and they get panic and get anxiety about their diagnosis, please do have consult with Bob, to
Thank
you
you.
get a
You're
second
very kind.
opinion.
You're very kind.
You can get clarity. He will guide you, he will coach you on your exercises and the rehab plan, and Bob is reachable all the time.
You're
Like
very kind,
anytime you
Jessica.
can send him message, he will reply it.
Thank you.
And
You're very kind, Jessica.
thank you very much, Bob, for having you as
Thank
my
you.
coach and
Thank you
guide
for sticking
me
to the plan.
for my
Thank you.
journey.
Thank you for sticking
Yes,
to the plan and consistency. Really appreciate
yes,
that. You're very good. You're
consistent.
very good. Thanks again.
Yes,
I hope you guys find this video helpful. If you're suffering from lumbar disc bulges, annular tear, or you're simply suffering from sciatica pain due to lumbar disc bulges, I would highly suggest you to avoid jumping right away for surgery and try a rehab plan for minimum 6 months. And I can guarantee you, you will change your mind in regards to the surgery, because I have so many successful clients all across the world who suffer from this injury and recover without surgery. You can watch the link below, my online clients testimonial, more than 60 different videos that you can watch, get some tips, learn how we work. And if you think this is something that you can stick and follow, I guarantee you, if you follow what I tell you, you will see results. I really appreciate, before you leave this channel, make sure to subscribe my channel for my weekly update and share this video with your friend and family who may need this information. Until next week, all the best.